This here is a pre-rehabilitation case study of an ankle sprain pathology. What is an ankle sprain? Ankle sprains are some of the most common sports injuries today, accounting for a quarter of all sporting injuries. Around 80% of ankle sprains occur to the lateral complex of the ankle joint, but more specifically the anterior talofibular ligament and the calcaneal fibular ligament. Ankle sprains usually occur when a dorsiflexion and inversion movement occur with an excessive amount of force. Here, what we can see is our client working on ankle stability while standing on a BOSU, also working on proprioception with the tennis ball being thrown towards the client. Also, what we see here is the client using a resistance band to work on plantar flexion. This here also works with the peroneals as well, with the stability of the ankle joint. What we can also see is the client is holding at full plantar flexion for a few seconds before releasing. What we see here is the client working on inversion with the resistance band. This exercise is good because it could be used in any location, even if the client is not with the therapist. Also, what we see here is the client working on dorsiflexion with the resistance band, holding for a few seconds when they reach full dorsiflexion. Furthermore, what we're working on here is a single leg step up without any weight on the bar. This here is also working on the quadriceps, trying to build the lower leg muscles as well. What the client is doing here is taking a step up, only using their right leg. This here is also working on the stability of the ankle as it is an unstable surface. What we see here is also a progression from the last one. This here is a single leg step up with weight on the bar. The weight is not too heavy as it is only around an extra 7.5 kilos to 10 kilos on the bar. As we can see, our client is still working on that right leg and that lateral complex of the ankle. This here is a good exercise as it is an unstable surface and also works on the strength of the quadricep, but also the lower leg.